volume down?
Now we'll try.
Just test it.
This is a mic check. We will begin our press conference around 1 p.m., so please keep up to date and stay with us.
the webinar open?
The broadcast is now starting. All attendees are in listen-only mode.
All right, very good. Thank you so much, everybody, for being with us today. Welcome to the Maricopa County News Conference for July 22nd. My name is Fields Mosley. I am the Communications Director for Maricopa County and the Lead Public Information Officer for the Joint Information Center, supporting Unified Command at this time. I want to thank members of the media for joining us on the webinar. We trust you always have good questions, and we'll do our best to answer those today. Also, those of you who are joining us via YouTube or Facebook, thank you very much for being here. And again, we hope you find this informative today. So there's a lot going on right now. A lot of people asking questions as to whether or not schools can reopen, should reopen, and what information they need to be best informed as parents, and also for those policymakers out there, school boards, mayors, the Board of Supervisors here at the county level, everybody seeking information so they make the best informed decisions. Public health, of course, is a part of educating and providing recommendations to all of those policymakers, as well as parents out there in the public who are making important decisions about what their children should be doing and need to be doing as school is scheduled to start this fall. And I'm in that same boat as well as a lot of other people in this room. So public health, it's important to know, does not have an enforcement capacity. They are here to educate, and it's also not their position to decide when schools will open. That is up to the governor. So Dr. Sonnenschein, however, will answer questions. She'll talk about the recommendations that public health has made that parents can look at. Those are public on the public-facing website, maricopa.gov right now, and you can take a look at those recommendations. But she'll talk a little bit more about that. I also have with us today Director of Emergency Management, Rob Rowley. He's going to talk a little bit more about PPE, because the logistics team here at Unified Command has, of course, tens of thousands of pieces of personal protective equipment that have been distributed to our long-term care facilities, also first responders at one point, and they also put together starter kits for any school that requested those starter kits, and he'll talk a little bit more about that personal protective equipment, what's been distributed thus far to schools, and how that might help schools get prepared if they do have in-classroom learning this fall. So a few items to touch on that I always touch on every week when we have a press conference. Members of the media, you'll be called upon by our moderator, Chad, who is on there. Please have your mic unmuted at that time, and then we'll unmute you from this end. If you're having a little bit of trouble with the GoToWebinar software and you're not able to raise your hand virtually in the webinar, please log out of GoToWebinar, log back in. Sometimes that resolves that. We cannot fix that or call upon you if we don't know your hand is raised. And I know that happens from time to time, so we'll do our best to get to you. So with that, I'll call up Dr. Rebecca Sonnenschein. Again, she is our medical director here at Maricopa County Department of Public Health.
Thank you, Fields, and good afternoon, everyone. I know that there are a lot of questions about schools, and particularly about reopening. This is a really tough situation that is constantly changing, and we all want what's best for students, staff, and teachers. Our role is to provide information based on data and science for schools and the public to make the best decisions for themselves. Outside of COVID-19 and the current pandemic, public health works with schools whenever there is an outbreak or any other infectious disease issue in a school. We have teams that work with schools on a daily basis throughout the year to provide them with health-related guidance. And this covers everything from offering standard vaccinations in schools, making sure kids are vaccinated, investigating outbreaks in schools, and working with schools to communicate with families and staff to minimize any spread of disease that's in the school. We do this all the time, and we have established relationships with schools and school districts across the county. There's a really good chance that we already know your school nurse or your health aide. We're working with our contacts at schools directly on COVID-19, just like we do with norovirus or whooping cough or chickenpox, but this is just on a much broader scale. So what does that look like, working with all schools on a broader scale? Keep in mind that the Arizona Department of Education has the authority over schools at the state level, and that school districts have decision-making authority at the local level. So we provide guidance and information based on the latest science, which is constantly changing, and local data and information for schools to base those decisions. And because this is a situation that is impacting all schools, not just one or two, like normally in outbreaks, the way we are delivering our information is changing. We're holding weekly webinars with schools in Maricopa County to give them updates on disease transmission locally, what's changing in the science, and including having guidance, specific guidance, and answering specific questions that arise from schools. We're asking our school contacts for their questions ahead of time so we can look up all the latest science and give them the best possible answer for their specific question, and so that everyone else can hear the answers to those questions. We want to make sure that everyone is hearing the same information and getting the same guidance. Based on that, we're providing them with specific tools to make decisions, including a scale that categorizes each activity by its risk level. We understand not all schools are alike, and they need to understand that they can make different decisions and just need to know what the risk of each is. So one example of that is meal service. Lowest risk is for students to be at home and eat their meals at home. If that is not happening, the next lowest risk is having students and staff eat in the classroom or in small groups maintaining 6 feet of distance, particularly facing in the same direction. The next level of risk would be having them eat in larger groups while maintaining that distancing, again facing in the same direction. And lastly, the highest level of risk would be having kids eat lunch in larger groups, mixing and not maintaining that 6 feet of distance. So everything's on a scale, and we're here to say what's the most risky and how do you decrease that level of risk. We've also categorized other common school activities so that schools can determine how they can implement lower risk versions of what the activities are. We've issued guidance, which is a formal set of recommendations on physical distancing, wearing a mask, and minimizing exposures while on campus. Maricopa County, as Fields mentioned, is also distributing personal protective equipment boxes to schools so that they have a set of equipment to work with should somebody become sick or have COVID-19 symptoms in schools. But we'll hear more about that from Director Rowley in a few minutes. We've also provided specific recommendations to ensure healthy environments that cover hand hygiene, cleaning and disinfecting practices, handling shared objects, ventilation, ensuring there's lots of airflow, and water systems. We're advising schools to ensure that students and staff isolate as soon as they have symptoms of COVID-19 or as soon as someone tests positive. And we're giving them specific guidance on how long they should stay at home when someone tests positive, either the person who's in the school or someone else in their household. Our goal is that all schools have the equipment, processes, and accurate information to address the potential of a student getting sick with COVID-19 symptoms while they're in school. Some issues that we're working on with partners are how schools report infections to public health and how to reach us when they do need specific guidance. We have a team that's available to answer those questions and walk them through those specific situations. When it comes to when to open and how, school districts are making those decisions for their schools, but we're working to provide them with as much information and data on which to base their decisions. For any schools or districts, again, that have specific situations to discuss, we're happy to provide one-on-one guidance. We understand that parents have a lot of questions about what reopening schools will look like, and we encourage parents to contact their schools to find out more. We cannot make decisions for schools, but what we can do is, if schools do reopen in person, is give them recommendations on how to hold school in the safest way possible for students and teachers and to minimize the spread of COVID-19 in that setting. In the meantime, we ask parents to work with their younger children and learn to wear a mask. We know that it's not comfortable when you first start wearing a mask, but we also know from experience that when you practice, it does become easier over time. So we want parents to work with their kids earlier in case they do need to wear a mask in school. And for everyone, we want you to know two things. Our case numbers are decreasing. So thank you to everyone who has been wearing a mask, staying home whenever they can, washing their hands, and staying 6 feet apart. We appreciate your doing that for the community. I also want you to know that we're not even close to being out of the woods yet. So we need to keep wearing masks, staying 6 feet apart, and staying home whenever we can, and staying home when we're sick, until our numbers are much, much lower than they are right now. So now I'll turn it over to Director Robert Rowley, the Director of Maricopa County Emergency Management, to talk about the PPE boxes we're delivering to schools. Thank you.
Good afternoon. My name is Robert Rowley, and I'm the Director for the Maricopa County Department of Emergency Management. Last week, the Maricopa County Unified Command began distributing PPE starter kits to assist school staff nurses when classes resume. This includes all public, private, and charter schools in Maricopa County for a total of 1,450 starter kits. Once our logistics section had established a list of schools wishing to receive PPE starter kits, a drive-through pickup location was established for schools that were able to come pick them up. Currently, 91 schools have picked up their PPE starter kits. The remaining kits will be shipped to the schools that were unable to come to the drive-through distribution location. So to provide a quick visual, we have the items here that are typically included in a PPE starter kit. We have one no-contact thermometer, 50 surgical masks, 100 pairs of gloves, this is 10 face shields, 5 reusable gowns, and then 10 disposable gowns. As the name starter kit implies, this is just enough items of PPE to get schools initially prepared for the start of the year. And school districts will be responsible for the procurement of additional PPE once this initial supply is used up. Thank you.
Thank you, Dr. Sunshine and Robert. So now we've come to the point where we'll do some questions and answers here. I have Joanna Molina also in the room today. As always, she'll be translating our answers in Spanish to better serve those who are bilingual or Spanish-speaking only, and also those members of the media who are from Spanish-speaking radio or television stations as well, to better serve you. So, Chad, if we have somebody on the line that has a question, we'll go ahead and start taking those now.
Okay, Nicole Grigg has our first question. Nicole, if you'll unmute your microphone, you're ready to go.
Hi, Fields. Hi, everyone. I just have a two-part question. How does the county feel that we as a community can be making timely and accurate decisions on schools if there's a backlog of tests right now with more than 60,000 tests at one of the state's largest labs? Isn't that concerning? And do you guys agree that we should have a criteria, not a date, to move forward for these schools?
All right, thank you very much, Nicole. Dr. Sonnenschein will take those two questions. Again, we're talking about the difficulty in making timely decisions when we know we have a backlog of testing, and we've discussed many times at these press conferences the backlog in testing and how that affects other aspects of tracking the disease in our community. And I'm sorry, second part of the question? I didn't get that written down so quickly. Nicole?
Yeah, just the second part was, do you guys agree with the call from teachers
Oh.
and educators that we should have a criteria, not a date
Yeah,
for
criteria
reopening
versus
schools?
date. Totally get it. All right. Thank you, Nicole, for that question. Dr. Sonnenschein will take those.
All right. Thank you for those questions. So I can't speak to the backlog at the labs, but what I can tell you is there's plenty of evidence that tells us that it's very important to have a rapid turnaround time between when people get tested and when those tests come back to public health. We know, and back to the people who got them, we know that the shorter the period that is when someone gets tested to when they isolate, the most effective public health can be in its strategies. And we also know that they have a much bigger opportunity to investigate those cases and notify contacts. So it is important that we have the laboratory capacity so that we can get that turnaround time down so that we can improve how fast people get their test results. And that is supported by the evidence. So to answer your second question, about using criteria to go back to school rather than a date, I definitely support that a specific date is not what's important. What's important is looking at local transmission of COVID-19 in the community. There are a number of different sets of criteria out there. I can't tell you specifically which ones to use. I think that needs to be decided by a group of experts in both education and public health. But things that you might consider including in those criteria are requiring a downward slope of confirmed new cases of COVID-19, a decrease in the percent positivity of test results, and having the widespread availability of testing with timely test results. So I think those criteria are important, and I agree that they probably should be considered much more important than just setting a specific date. Thank you.
La pregunta es cómo se siente el condado si estamos retrasados en el reporte de casos que llega por los laboratorios de salud pública. Y la segunda parte es cómo saber qué día empezar las clases en lugar de poner una fecha límite o para empezar, sino tener mejor una lista de requisitos que se puedan cumplir antes de empezar las clases. Bueno, la primera parte es que es importante que los resultados de los laboratorios lleguen lo más pronto posible a los resultados a salud pública al condado Maricopa. De esa manera se puede dar seguimiento a los casos. De otra manera se retrasa y no podemos seguir a los casos que pudieron haber estado expuestos. También es importante tener más capacidad en los laboratorios que están haciendo estas pruebas. La segunda parte de la pregunta es cómo saber qué día empezar. En lugar de poner una fecha, debería de haber ciertos requisitos para cumplir antes de iniciar. Y sí, tener una fecha no es lo importante, sino saber que los números están bajando, saber que hay menos transmisión en la comunidad es importante y también tener los resultados de las pruebas mucho más rápido que lleguen a salud pública al condado Maricopa.
Thank you, Nicole, for those questions. Chad, do we have somebody else on the line with a question?
Peter Seymour has our next question.
Okay.
Peter, your microphone is live.
Hello, everybody. So I know Dr. Sonnenschein wouldn't give actual, data or actual metrics, precise metrics about when to reopen schools, and she said community by community basis. Who should determine what the criteria are? Should numbers be included in that?
So, Peter, just to be clear, you're asking who should determine which numbers are the numbers we look at, whether I believe the number 5% infection rate has been thrown out there, those kinds of numbers?
That's correct. And I've heard 10% too, but I can understand 5%.
Okay. Dr. Sonnenschein will expand upon that a little bit.
As I mentioned before, using a certain set of criteria, I think, is very important. And the people who should make those recommendations should be, I think, a group of public health experts and education experts, because you have a lot of different pieces to take into account. And you also want to make sure that you're taking into account local disease transmission and information that is from the specific area. So to me, it's important that it's made at a local or state level, and that it has different levels of expertise from both public health and education to put forth a set of criteria that is based on the literature. I'm not in a position to say exactly which ones I would choose, but there are several different sets of criteria out there, and I think they should all be reviewed, and then the group should come to a consensus based on their different areas of expertise.
La pregunta es que ¿quién determina el sistema métrico para empezar las clases o para bajar el nivel de contagio en la comunidad? Bueno, es importante usar ciertos requisitos para empezar. Debemos de ser personas que hacen un comité tanto de salud pública como del sistema educativo, y debe ser importante que cada quien traiga su experiencia en esas pláticas y también usar los datos de la ciencia, los niveles de contagio que se ven al momento en la comunidad, y así tomar decisiones basadas en beneficio de la comunidad.
All right, thank you, Peter, for the question. Thank you, Dr. Sonnenschein. Do we have another question?
Carissa Pano has the next question. Carissa, your microphone is live.
Yeah, good afternoon. This is a question for Dr. Sonnenschein. If a school decides to open, what is the recommended course of action for that school to take if either a teacher or a student tests positive while in-class instruction is happening? What is the healthiest route for schools to take?
All right, so in a particular situation, what is the healthiest route for a school to take if a teacher or a student tests positive while classes are in session? And of course, we're talking about in-person classes. Dr. Sonnenschein?
I think that's one of the situations that schools are most concerned about, and that's exactly why we put together this PPE starter kit for schools, to make sure that in the situation where a teacher or a student comes down with symptoms, whether or not they know that they have COVID, the first thing you want to do is you want to remove that student or teacher away from other people. You want to put a mask on that person. That's called source control. And then the health aide or the school nurse or whoever is available to evaluate that person needs to have full personal protective equipment on, which means a surgical mask, eye covering, a gown, and gloves. And we want to make sure that those school nurses and health aides have the protection that they need, and that they know that that person has to be separated from everyone else right away. At that point, depending on how sick the person is, once they're isolated, they need to be sent home or sent to seek further health care if that's what's required. And again, we have a team of people at Public Health where if they have issues in that situation, they will be able to consult with local public health to learn what to do specifically.
La pregunta es que si una escuela decide abrir para clases en persona, ¿qué debe hacer si esa escuela, una maestra o un estudiante resulta positivo a la pandemia, a lo que viene siendo COVID-19? Bueno, eso es lo que muchas escuelas les preocupa, el tener que abrir y que alguien se enferme en sus instalaciones. Por eso la importancia de tener el equipo de protección personal a la mano. Estamos hablando de que esa persona cuando se enferma en terrenos escolares se debe de quitar de estar alrededor de otras personas. La enfermera o el personal que atienda a esta persona debe utilizar una mascarilla, una bata y también los guantes. Inmediatamente buscar atención médica para que les digan cuáles son las instrucciones a seguir y enviarlos a casa. También nuestro equipo personal, nuestro equipo de salud pública del Condado Maricopa de epidemiología trabaja muy de cerca con las escuelas para tener esa comunicación y saber qué deben de hacer o cómo deben reportar esos casos.
All right, thank you, Carissa, so much for the question. Chad, do we have somebody else?
Juan Juarez is next. Juan, your microphone is self-muted. If you'll unmute it, ready to go.
Thank you. So I also have a two-part question, and the first one is the PPE you mentioned. This is for nurses with the starter kit. What about the teachers? Can they expect to get PPE from the county as well? If not, what is going to take for them to get that as well? Do they need it at this point if they go back to the classrooms? And the second part, again, is I got a little confused. I don't really know the exact recommendation as far as to what data you guys are providing people at schools to know when it's safe to come back. It was kind of, I felt, still too generic or up in the air. So if you guys could just maybe clarify a little bit more what exactly you guys are looking at and recommending. So if you could answer those two for me, that'd be great.
Okay, so a little more specificity on what data we would be looking at or school districts should look at as they make their policy decisions on whether or not to reopen for in-person classes. But we'll start off with Robert Rowley, talk a little bit more about PPE, the starter kit, and then what should take place at the individual school level so teachers feel most protected. Robert?
So the short answer is no, we are not going to be providing every teacher in Maricopa County with PPE or face masks. Now, that answer said any request that comes into the Unified Command for resources or personal protective equipment is evaluated on a case-by-case basis. And if there are extenuating circumstances, we will certainly look into trying to fulfill those requests. But it needs to be understood that the supplies, the cache of personal protective equipment that the Unified Command maintains is not sufficient to solely supply any sector out there. We could not solely supply hospitals or first responders or all of the schools and teachers with everything that they would need. We simply do not have that kind of supply on hand. Our cache is maintained solely to fill in gaps where first responders or hospitals or long-term care facilities are getting close to running out of needed resources, and we can keep them in business until they can receive PPE through their own supply chains when they start coming in.
Bueno, son dos preguntas, pero la primera es que si las enfermeras que usan el equipo de protección personal va a ser para ellas, pero ¿qué pasa con los maestros? ¿Acaso ellos deben utilizar el equipo de protección personal cuando estén en clases? La respuesta es que nosotros en el Comando Unificado no necesariamente proveeremos todo el equipo de protección personal a cada escuela y a cada maestro en el Condado Maricopa. Sin embargo, se trabaja muy de cerca con muchas agencias, incluyendo los hospitales, las escuelas y otros sitios como de cuidado médico de largo plazo, para cuando a ellos se les está acabando el equipo de protección personal, el Comando Unificado del Condado Maricopa pueda ayudarles y suplir con lo que hace falta en el momento. Pero no es indefinido, no es una ayuda que estará para siempre. Solamente se trabaja a cómo llegan los pedidos y así de esa manera se puede ayudar en el momento.
Thank you, Juan. To answer your second question, what data is going to be provided in order for schools and school districts to make these decisions? It's really data on case rates. So any data that we have to demonstrate that the levels of community transmission have gone down. So individual case rates, hospitalization rates, how many people are being hospitalized, who is being hospitalized, what age groups, the percentage of tests that come back positive. We know that the lower that percent is, the better we're doing at capturing the positive cases that are out there. And lastly, the turnaround time from when you get your lab test drawn to when you get your test result back. When we can get that turnaround time shorter, we know we have more ability in public health to control the spread of disease. So that's the data that public health can provide, but there's also important information that the schools can can provide. How many students do they have per classroom? How many teachers per students? How big are the classrooms? Can they maintain 6 feet apart? Do they need to cut the classes in size? How much equipment do they have available to ensure that students can maintain that 6 feet of distance? All of those things need to be taken into account and really should involve a group of people putting all of the information together.
La segunda pregunta es, ¿y qué datos debemos considerar antes de abrir las escuelas? Bueno, esto es basado en el índice de casos que se ven al momento, también el índice de transmisión comunitaria, también el índice de hospitalizaciones y también los resultados positivos que lleguen al condado Maricopa, cuáles son las edades que están siendo más impactadas por COVID-19. Toda esa información se debe de considerar antes de abrir las escuelas y también las escuelas tienen que tomar en cuenta si en sus clases, en sus aulas, ellos pueden mantener a los estudiantes 6 pies de distancia unos de otros y también cuántos estudiantes tienen y si tienen la capacidad para dar seguimiento si hubiera alguna situación de esa índole. Por eso es importante tomar decisiones basadas en lo que son los datos con diferentes organizaciones y de eso hay que tomar decisiones.
Juan, thank you so much for the questions, and thank you guys for the answers. Let's go on to the next person on the line. Chad?
That's Colleen Sikora. Colleen, your microphone is live.
Hi, thank you for taking my question. So Dr. Sonnenschein talked about if a student or teacher comes down with COVID and separating that person out. But what will the protocols be, for following up? Will everyone in the classroom be tested, quarantined? How will notifications be handled that someone has tested positive in that classroom or in the school? And then has public health considered when a recommendation might be made for a school to close down?
Okay, a lot to unpack there. All right, thanks, Colleen, for that question. But Dr. Sonnenschein, do you have a list? All good questions, though, about what happens when you do have a positive case in a school. So Dr. Sonnenschein will do her best to answer those questions.
When a student or a teacher tests positive in a classroom setting or anywhere on school grounds, after isolating that particular person and getting them separate and away from everyone else, public health will be providing recommendations to the teachers and to the school nurses and health aides to help develop a line list of people. And so what happens is public health individually looks at these situations or works with the school to do this to find out who was within 6 feet of that individual for 10 minutes or longer. And that's how we define a close contact. It's similar to the CDC definition. It's actually a little bit stricter than CDC's definition. And those people who are considered close contacts will be notified of their exposure and be given instructions on how to quarantine and what signs and symptoms to look for. So that is something that we'll work directly with the school on. We're at a point now where schools are not required to report COVID-19 directly to public health, but we are hoping that schools will report at least when they have at least 2 cases that are unrelated, so not in the same household, within a 14-day period, and that's when we'll work with them to see what's going on in the school and make sure that there's not any type of outbreak there. Thank you. Oh, and then you also asked, will we be shutting down the school or recommending shutting down the school? And that is absolutely going to be based on the individual circumstances of what is happening. It depends on the percent of students that are absent, the percent of students that are having symptoms, what type of exposure there was, and what community transmission looks like. So that really would be on a case-by-case basis.
La pregunta es, ¿cuál es el protocolo si alguien da positivo en una instalación de escuela? ¿Cuál se pondrá la persona en cuarentena o se cerrará la escuela? Esa es la pregunta. Bueno, cada un estudiante o maestro que pueda dar positivo o que se enferme o que presente síntomas se debe aislar inmediatamente. Salud Pública siempre dará recomendaciones e individualmente, caso por caso, se dará seguimiento. Sabemos que la persona debe estar dentro de 6 pies unas de otro y es la investigación que Salud Pública hará. ¿Quién estuvo cerca de esa persona contagiada? Llamarles, comunicarlos y ponerlos también en cuarentena y también notificar cuáles serían los síntomas en caso de que se presentaran. Las escuelas no van a reportar directamente a Salud Pública al menos que presenten 2 casos de 2 familias diferentes. No tiene que ser de la misma familia, para ver si no hay un brote de enfermedad en esa escuela. También basado en el porcentaje de estudiantes y también que están ausentes o que dieron positivo a las pruebas de COVID-19 es como se determinará si se cierra la escuela o no.
Thank you, Colleen, for the questions. Chad, who do we have now?
And Ryman is next, and
Okay.
if you'll unmute your microphone, you're ready to go.
Hey, could you give us an idea of what school will look like if schools open to in-person instruction and follow your recommendations? You know, besides kind of the obvious things of the 6 feet apart and things we're used to. I mean, what are the biggest changes and things that people are going to have to follow?
Well, from the list I've seen so far, it's been very similar to what we've been recommending. You know, the 6 feet apart and masks, of course, being required is the recommendation of public health. Dr. Sonnenschein can expand on that a little bit more.
As Field stated, we can't tell you exactly what school is going to look like. It's really going to depend on the individual school. Again, how many students do they have? How many classrooms do they have? How big is it? So once a school is comfortable that community transmission is low enough that they want to have school in person, they can refer to our guidance, which gives recommendation based on the risk of each activity. Our strong recommendation is that when students and teachers do go back to school in person, that they all wear masks, and that's with the exception of those who can't wear them for medical reasons. We strongly recommend that they wear masks to reduce any spread because we know maintaining 6 feet of distance throughout the entire day is very difficult. But we would strongly recommend that they do everything they can to keep 6 feet of distance maintained and to make sure that hand sanitizer is available in all the classrooms, that students and staff have an opportunity to wash their hands, and that meals are in a situation that minimizes the spread of disease, such as what we described earlier, eating lunch in small groups and making sure that there are not shared objects touched and that meals are individually wrapped. So there's all kinds of different things to think about, shared items that would have to be addressed individually. So it really just depends on the different schools.
La pregunta es que si cómo se verán las escuelas cuando reabran, cuáles son los cambios más grandes que se podrían ver. Bueno, como sabemos, la recomendación más grande que tenemos en este momento es el utilizar la mascarilla y mantener el distanciamiento de 6 pies. No sabemos cómo se mirará cada clase, cada aula o cada escuela debido a que depende de qué tan grandes sean esas escuelas, qué tan grande sea el espacio que tengan en el aula. Y basado en eso se verá cómo ellos reciben la guía de salud pública y la ponen en práctica. Eso incluye nuevamente el uso de la mascarilla durante el periodo de clases, mantener 6 pies de distanciamiento unos de otros, lavado de manos y el uso del desinfectante a base de alcohol. También comer en grupos pequeños y también traer las comidas empaquetadas individualmente. Entonces todo depende de cómo sea el ambiente en la escuela y qué tan grande.
Thank you, Ann, for the question. Who do we have next, Chad?
We have a follow-up question from Carissa. Carissa, your microphone is live.
Hi, thanks. Actually, somebody else asked my follow-up question earlier, but I do still have a question. For those who are saying that we need to open up our schools, they argue that kids are not getting severely sick from COVID-19. So my question is, does the county have any data that reveals how sick kids and teenagers can get from COVID-19 and their ability to infect others?
I believe we do know the infection rate. I don't know about how sick, but Dr. Sonnenschein can say a little bit about that.
I think that's really important to consider, and we now have a lot of data from China, from South Korea, and from a number of other countries that tell us that children, particularly healthy children, do tend to get a lot fewer symptoms when they become infected with COVID-19. We also know that there's something about younger children that they're actually less likely to become infected, and we don't know why that is yet. However, a recent study came out based on a very large data set, which showed us that children aged 0 to 9 actually do tend to have lower rates of transmission in their households when they're the first person in their house to get sick. And that's lower than adults and everybody else. But kids aged 10 to 19 actually have a higher rate of transmission in their households. So that breaks kids into different categories, so we can't say the same thing for all kids. What we know for sure is that children can transmit the disease to each other, and they can transmit it to adults. We still think adults transmit it better than kids, but they absolutely can spread the disease, and if you get a lot of people together and anyone is infected and they're not wearing masks and they're not maintaining 6 feet of distance, there's a strong likelihood that COVID-19 will spread in that community. So I also want to remember the staff and the teachers that are in schools. They are adults, they are more likely to have severe illness, and you want to make sure that they're protected as well. So you don't want to just consider what's happening among those younger age groups, but considering the whole community is important as well.
La pregunta es para quienes dicen que hay que reabrir las escuelas porque los chicos no se enferman gravemente en comparación de otras personas. ¿Qué les decimos de parte de Salud Pública? Bueno, tenemos datos recientes de China y de Corea del Sur, y los niños muestran menos síntomas que las personas adultas. Pero también un reciente estudio que ha dado a conocer diferentes edades, por ejemplo, de 0 a 9 años, ellos cuando se enferman tienen menos riesgo de transmitirlo a otras personas en su propia casa. Y sin embargo, de la edad de 10 a 19 años, se puede ver que ellos ponen el mismo riesgo de transmisión a otras personas en su propia casa, es mayor. También lo pueden transmitir, nuevamente recalcamos, de chicos a grandes cuando están en un ambiente donde no se mantiene el distanciamiento físico y tampoco se utiliza una mascarilla. Hay que considerar también que las personas adultas como los maestros pudieran estar en riesgo más alto también de transmisión y de enfermedad más seria, precisamente porque pueden tener otras condiciones crónicas.
Carissa, thanks for the follow-up questions. Chad, do we have somebody else?
Oh, we do. Ann has a follow-up question.
Okay.
Ann, your microphone's ready.
Hi, a question on if you're in close contact with somebody at school who tests positive, and you mentioned then they would be instructed on how to quarantine. How long would the person who was in close contact then quarantine?
Okay, good question. Thank you very much, Ann. Dr. Sonnenschein, talk about that.
Someone who has been in close contact with someone who has confirmed COVID-19 needs to remain quarantined or away from others for 14 days following their last exposure to the infected person. So The reason why we use 14 days is because 14 days is the incubation period, or the time from when you're exposed to a disease to when you can actually develop symptoms of the disease. So we know that once 14 days has gone by from the last exposure, if you haven't developed symptoms from that exposure, you're not going to. Unfortunately, we do know that up to 40% of people can have the disease and be infected and never develop symptoms. So that's when there is a rule for testing at the end of that 14-day period.
La pregunta es que si están en contacto cercano con alguien que ha estado infectado en la escuela, ¿cuánto tiempo debe de estar esa persona en cuarentena? La respuesta es que debe de estar 14 días aislado desde que estuvo en contacto la última vez con la persona que dio positivo a COVID-19, porque el periodo de incubación de la enfermedad son 14 días. Sabemos que después de 14 días el riesgo de padecer la enfermedad disminuye mucho más, pero también sabemos que hasta el 40% de las personas no presentan síntomas. Por eso, después de los 14 días, se recomienda hacerse la prueba para saber que no está infectado con COVID-19.
All right, we have time for one, maybe two more questions this afternoon. Do we have anybody else on the line, Chad?
That was the last question we have right now.
Well, I didn't even need to say that then. All right. I'd like to thank everybody for joining us today. And before we go, I do have a little bit of a public service announcement. There has been a bit about all the testing sites, and I know our friends in the news media, the reporters out there, and the producers, they've been doing a good job reporting on the expanded testing that we're seeing all around the county right now. Our partners at ADHS, at the state, of course, they've run a lot of this for many months now, but also the city of Phoenix has gotten involved. And I do want to mention those FEMA testing sites that were requested by the city of Phoenix. They asked us today to mention those one more time. Maryvale High School, South Mountain Park. And those are open. They're open Tuesday through Friday, 6 a.m. to 2 p.m. And they are available for people who need tests. Now, they do ask you to sign up online, but if you just show up and their numbers are low, they will try to work you into the system, from what I've read on their website. The website is kind of, it doesn't look like a lot whenever you're looking at it, but it's doineedacovid19test.com. doineedacovid19test.com. So there's also some other locations mentioned at that website as well. There's an opportunity to pre-register if that's what you need to do, or you can go and check those out. But certainly they want to make sure that the people who need to be tested in our community do get those tests. So I'd like to ask Joanna to translate that real quickly before we close this out for the day. There's the information.
Bueno, y para finalizar, queremos mencionarles que hay pruebas para hacerse de COVID-19 por todo el estado. Desde a nivel estatal, local, también se han involucrado para hacer estos sitios de pruebas, y muchos de esos sitios no requieren que usted tenga seguro médico. Entonces, la recomendación es que si usted no se ha hecho la prueba y quisiera hacérsela, hay sitios que también han llegado del gobierno federal, de FEMA, y puede empezar a ir usted a hacer su cita, ya sea en línea, o también puede visitar estos sitios si no tiene una cita previa, y lo podrán acomodar si usted llega y hay espacios. Estamos hablando de la preparatoria Maryvale y también del parque South Mountain. Están disponibles de las 6 de la mañana a las 2 de la tarde, de lunes a viernes. La recomendación es que se registre, pero vuelvo a recalcar que si usted no puede registrarse y llega y si hay espacio, lo podrán ver.
Well, thank you, everybody, for joining us today here for the Maricopa County press conference for this week. We appreciate you being here. We appreciate all the good questions from the reporters who are reporting on these very important stories during this pandemic. We thank you, and we'll let you know when the next availability is.